Hello, everyone. This is Raj, Doctor of Physical Therapy. Today, we are going to talk about very personal, um, topic. It's a sad topic. Dr. Ryan Perron lost his mom a couple of weeks ago to cancer, and he is here with me today. He would like to, I requested him whether it is okay to talk about cancer, death, grief. He's going through grief, and he politely agreed, and which is so I can't even say how in a it's a hard topic. Excuse any mistakes that we make. Just want to share, um, you know, w- I what Ryan can talk about. So let me bring Dr. Perron onto the screen. Hey, Dr. Perron, how are you doing?
I'm doing well. Thank you, Rod. How you doing?
Yeah. So I'm so sorry for your loss, and again, it's a very hard topic. It's very hard. I personally had one loss which I couldn't. It was hard to take,
Hmm.
yeah, please, could you please talk about, you don't have to be give very specific details, just talk about the you know how, since the diagnosis, what are the challenges, and probably dealing with the death and the grief, if you could.
Yeah, this was something that was about 17 years ago when it started,
Oh,
and
wow, that's a
yeah,
long.
it was. So fortunately, it's one of the things you do in these situations is look back on the things you appreciate and are grateful for, and give that some time and thought. That helps to get through these process. And she had a tumor in the kidney, near the kidney, and the kidney was removed, and then did really well, no problems. 5, 6 years later, had a tumor in the brain, and that got removed, and then cancer kind of started spreading throughout the body and the lungs, and was taking some medications to really suppress the cancer and not let it spread as rapidly. And that lasted for quite a while till about 3 years ago. Then it really started to get more and more difficult for her physically. And then probably the last 6 months, 8 months, she was having some cognitive issues, just being very forgetful, trying to, find the right words to say and that. But she was a great mother, a great woman, always
Right, I mean,
still,
that's
caring about others and asking about others' feeling, and as always smiling, and so anyway, the funeral services was a lot about the good things that she's done, and that, and so I think that's one of the important things to go through these processes. Everybody has their own way with dealing it and that, but when you have an individual that you love and miss and care for, you want to think about the good things that you've done with them. And with that being said, when you still have them around, if you knew that that time was coming and that you would forgive them or you would say kind things to them and do all those things, then why not do it now?
yeah. I didn't know that she survived. I mean, that long, which is great. I mean, she's a
Hmm.
cancer survivor for how many years? Like for
Yeah, yeah, yeah,
30 plus.
yeah.
Yeah, yeah, that's
It's one of
amazing.
those things you knew it was coming, so that
Right.
kind of helps prepare for it, and then but it doesn't necessarily make it easier, but
Oh
it does
no,
make
no.
it easier too, versus someone who had you hear about somebody having cancer diagnosed and then 3 weeks, 3 days later, they passed away. And so
Yeah,
those are, you know, so
I
every
have.
situation is unique. And I think as a professional, we come across these
I,
a time or two, maybe more so than the other, you know.
that's right.
It's,
And I worked with several hospice
mm-hmm.
patients,
Yeah,
and the thing I observed is the motivation. Some of them, the patients I've seen, especially in home health and hospice, they want to participate in therapy. So
yeah,
I've seen only the best where
yeah,
they are challenging. They were motivated to participate in therapy. But I don't know, I mean, there may be so many people that on the other end of the spectrum where they feel like they're done with life and they don't want to do
yeah,
anything at
yeah.
all. Yeah. So was your mom being active? Like, was she doing therapies or active, like walking and doing more exercise herself, or how
Yeah,
was she?
she was doing what she could,
Sure,
and
yeah.
then you get to the point where it was just, sometimes, the cancer had affected the part of the brain where the tumor was removed, and then the doctor said, yeah, probably, 8, 10 years later, the feeling of that left lower leg being weak and not wanting to do what it needs to do will come back again. And that's what she was having. And so I was having to use a walker and really had to just think of what you were doing so you didn't trip yourself up.
Right.
And so just the activity in that was getting harder and harder to do. But
Yeah.
yeah, I just did what she could. And that's one of the things I find with a lot of the patients I work with. And I know religious beliefs can have a strong, background and whatnot, but I find that no matter the religious beliefs, we have a lot of people that just have, like what you said, Roz, they want to try, they want to just do what they can and
Yeah.
participate. And I think that's one of the great things about that. And I bring that up. I let the patients know, maybe right now you don't have much to give, but what you're doing right now is setting a great example, and you
Yeah.
are motivating others and inspiring others despite the circumstances you're trying. And
Exactly. Yeah.
I'm inspired by that. And of course, you get some that just aren't inspired anymore and motivated, and I respect that too.
Right, right. Yeah.
Yeah.
I think, based on, everybody's life is
Hmm.
different. Everybody's perception of things is different. Um, and it varies from culture to culture and, people to people. So there are so many variables. Nothing is, wrong, but the way you deal with it is, it's so different for each person.
Yeah.
And when I had so basically we lost a baby at birth, um, and that was so hard. That was my first baby, and it was so hard for me to deal with. Like, for 15 days. I mean, 15 days I didn't go to work. I mean, I was off completely, and I was in a I didn't know how to see people because we were expecting a baby, and that was so hard to deal with. Um, and Yeah, I mean, I don't know how other people would have reacted, but that was my response. I mean, like, I
Right.
couldn't. I
Right.
mean,
Yeah.
yeah. So everybody's situation is different, dealing with the grief after
Yeah.
they leave. So, or how are you dealing with the grief as a,
Yeah.
yeah,
No, it's
as
good.
a son,
One of
as
the
a
things is,
professional? You
yeah,
can share both.
keeping yourself busy. You
Yep.
got to get moving forward. Time is not gonna, the world's not gonna pause and wait for me to, get me back on my feet and say, okay, I'm ready to go now. But you do have to have that grieving process where you stop and think, and reflect, and it's the time to reevaluate, reprioritize what's important in my life. And those are moments, and those can be a good thing.
Yes.
As hard as it is to go through it, it can become an opportunity to make oneself better. And I find it interesting. I find that the other day I was thinking about it, how I'm dealing with it differently than my family, and my family's doing well with it. Is that my profession? As a physical therapist, because the last 15 years, I'm always looking at the situation from the patient's perspective. And so
Right.
I've developed that with years and years of practices. Before I do anything, or do any course of actions, I'm looking at it from their perspective, from their history, and what they share with me. And a lot of times when you're doing that, um, it hurts. They're in pain, they're not feeling the best, and they're weak and tired and dizzy. I mean, there's a lot of disabilities going on, but there's that underlying thing that they're trying and they want to do better, and they appreciate a therapist, helping them in that. But that is the one thing that I wanted to share with, was the perspective. And then, due to my religious beliefs, I look at it from my mother's perspective. And as I leave my thoughts with that, with her perspective, she's at peace. She's in a good place. She's
Right.
enjoying it, and I believe that she is still very much aware and involved what's going on in my life right now, and
Right.
that we believe that she's in a state of just moving on, and taking the next step that all of us will be
Sure.
taking.
Yep.
My dad has said none of us is getting out of this earth alive.
Yeah.
But to that. But that's just the religious beliefs that I have helped me to see from her perspective, and that's a good thing. And I believe that she would want me to just move on. Thinking the thought that if you could only see what I see,
Yeah.
you'd be doing well. And so those are things that help to go through the process. And yeah, there's times you stop and think about the things
Yeah.
you're
It's a
missing
wave
out
of,
on. And mhm.
comes and goes.
Oh yeah, yeah, it
So
does. Yeah.
yeah, so you feel like you're distracted doing something, and after
Hmm.
that, you just sit down and you start thinking about them
Yeah.
again, those
Yep.
who passed away. So
Yeah. It's a
um,
definite roller coaster ride.
it is a roller coaster,
Yeah.
but I'm glad you're dealing with it well, and it's your mom. Where most I don't. I know some people may be distant to parents, but you know I believe you were close to mom, and I am close to
Hmm.
mom. I talk to her,
Oh yeah.
frequently, and we talk for a
Yep.
long time. So yeah,
Yeah. She's a
so
very big part of the person I am today and why I am, because of
exactly,
that
yeah,
closeness. And yeah, so I think that's another good thing. I feel like, I still have a big part of her, of me.
yeah,
And so,
yeah. Sorry again for your loss, and thank you so much for showing up today to talk about this is the hardest topic, and thank you again,
you
Ryan.
bet. Yeah. Well, thanks for the opportunity, Raj. Thank you.
You're welcome. Thank you. And I'm ending